Hello all. On behalf of the Department of Health and Human Services Office on Women's Health, I would like to welcome each of you to today's pre-award technical assistance webinar for potential applicants of the Medical Forensic Access Initiative, an initiative created by the Office on Women's Health to improve access to medical forensic examination services for women and girl survivors of sexual assault nationwide. Before moving into the content of this webinar, it is best that we stop to ensure all have read the Notice of Funding Opportunity, or NOFO for short, for this initiative. If you are interested in taking part in the Medical Forensic Access Initiative, the NOFO is the best source of guidance and information you can find. We always encourage applicants to read the NOFO carefully and in its entirety before they start crafting any sort of application, as the information within the NOFO takes precedence over any other information in other documents. Even the information shared in this webinar does not take or replace the content of the NOFO and should not alter your own thorough review of the NOFO and the expectations, application content, and scoring criteria outlined within it. Today's webinar will provide a high-level overview of the Medical Forensic Access Initiative and how this funding opportunity aligns with the mission and vision of the Office on Women's Health, abbreviated here as OWH. After that, we will dive into the purpose of this program, the population of focus, and what recipients of this grant are expected to achieve as they fulfill those goals. We will also cover what content you should include in your applications, including items such as appendices, budget practices, project abstracts, and additionally, we will outline the eligibility criteria for recipients of this program and what steps you need to take to ensure that you are in line with formatting requirements, have all the required registrations completed, how to submit your application package to grants.gov, and the common criteria that disqualify applications. After that, we will give an overview of the process once your applications are reviewed and award decisions are made, including the merit review process, risk assessment, and the eventual dispersal of award notices to those awarded. Then we will close out this webinar with a few tips for applicants. Here you can see OWH's mission, which is to provide national leadership and coordination to improve the health of women and girls through policy, education, and innovative programs. Because OWH's vision is that all women and girls achieve the best possible health, and OWH works in a wide array of health topics to ensure that mission and vision are achieved. The Medical Forensic Access Initiative aligns with this mission, as well as the Violence Against Women Act Reauthorization Act of 2022, which directs funding to support data collection, reporting, access assessment, and healthcare systems improvement related to medical forensic examinations for women and girl survivors of sexual assault. As such, this initiative fulfills the mission and goals of both by focusing on improving access to evidence-based medical forensic examination services for women and girl survivors of sexual assault through healthcare system strengthening, workforce development, data modernization, service coordination, telehealth expansion, quality improvement, or other related public health approaches. However, before we get into the specifics of this program, I wanted to provide some background as to why this is such a vital issue. According to the Centers for Disease Control and Prevention, sexual violence is an incredibly prevalent issue, with around half of women experiencing sexual violence in some form at some point in their lifetime, with more than 1 in 5 women experiencing rape or attempted rape. In these instances, it is critical for women and girl survivors of sexual assault to receive timely access to medical forensic examinations as part of the comprehensive healthcare and crisis response to this issue, as medical forensic examination serves multiple key functions, such as the assessment and treatment of injuries sustained, the prevention of sexually transmitted infections, and ensures the collection of evidence related to the assault. These examinations also include vital next steps for survivors of violence by performing safety assessments, behavioral health support, and referral to ongoing medical and supportive services that prevent further negative health outcomes that stem from the assault. Despite the urgent need for medical forensic examinations for survivors and the long-standing efforts to strengthen forensic healthcare systems, significant gaps remain in the access to medical forensic examinations across the United States. With women and girls survivors in rural, tribal, territorial, and underserved communities often experiencing substantial delays in receiving the care they need. These gaps are present for a host of reasons, with some of the most common current challenges contributing to them, including workforce shortages of those equipped to perform these examinations, geographic barriers for rural and remote areas, limited healthcare infrastructure support for forensic medical examinations, inconsistent availability of these services across localities and populations, insufficient coordination and linkages of care across healthcare and victim service systems for survivors of violence, and a lack of a unified system that tracks overall access to forensic examinations for women and girl survivors of sexual assault. The Office on Women's Health recognized the plethora of gaps remaining in this space, which is what led to the creation of the Medical Forensic Access Initiative. And that brings us to the details of this funding opportunity. Per the NOFO, the Medical Forensic Access Initiative has an estimated funding total of $5 million available, where the estimated number of awards is between 1 and 5, and an anticipated award funding range of $500,000 to $1 million for projects awarded. Those awarded can anticipate a project start date of September 30th of 2026. As stated before, the overall goal of this initiative is to improve access to medical forensic examination for women and girl survivors of sexual assault. And this grant serves that goal by funding projects that will strengthen healthcare delivery systems, improve statewide and regional reporting capacity related to sexual assault and medical forensic examinations, identify gaps related to healthcare access for survivors of assault, and support systems-level improvements related to forensic healthcare services. These goals can be achieved through a variety of approaches, and the NOFO outlines that projects awarded through this initiative may include activities focused on workforce expansion, healthcare coordination, telehealth-enabled forensic care, data modernization, quality improvement initiatives, and evidence-based systems integration as they work to shore up the gaps in access to medical forensic examinations. This initiative goes hand in hand with the Make America Healthy Again priorities, and all applications for those looking to be funded by this initiative must align with these priorities. Applicants should ensure they fit with these priorities by including how they are addressing gaps in forensic medical examinations through a root cause approach, advancing evidence-based clinical practice for medical forensic examinations, streamlining services for survivors of assault, promoting patient-centered care, and generating scalable interventions capable of system-wide adoption. Awards for this initiative will be in the form of grants to the recipient, which means there is no substantial involvement from the federal government in the funded projects. Instead, the recipient is responsible for sound programmatic and administrative judgments, and responsibility for operating decisions are the recipients, not the responsibility of HHS, OASH, or OWH. While there is no substantial involvement in grants, federal staff may still provide routine monitoring and technical assistance of projects under this initiative that include steps such as monthly conference calls, occasional site visits, reviews of plans in progress, meetings or one-on-one calls, and training or technical assistance related to programmatic performance. If you have any questions about this after being awarded, you are to coordinate with the assigned federal project officer and grants management specialist for your project. And now that we've gone over the background and purpose of the Medical Forensic Access Initiative, we can move into what your application package should look like and the content you must include. As outlined in the NOFO for this initiative, those eligible to apply for this funding opportunity include any public or private profit or nonprofit entity located in a state, which includes one of the 50 United States, the District of Columbia, the Commonwealth of Puerto Rico, the U.S. Virgin Islands, the Commonwealth of the Northern Mariana Islands, American Samoa, Guam, the Republic of Palau, the Federated States of Micronesia, and the Republic of the Marshall Islands. Additionally, community-based organizations, faith-based organizations, and American Indian, Alaska Native, and Native American organizations are also eligible to apply. While all these entities are eligible to apply, greater consideration will be given to state, local, tribal, and territorial entities, tribal organizations, and applicants demonstrating formal partnership with these entities, given the abundance of gaps related to access to medical forensic examinations among these populations. Coming to expectations for project directors or principal investigators, or PDPI for short, for this initiative. There is no restriction on an individual's eligibility to be a PDPI on an application. However, we will not make an award with a PDPI who has an active government-wide exclusion, suspension, or debarment recorded in SAM.gov. We expect that throughout the period of performance, the PDPI will be involved in and have substantial knowledge about all aspects of the project. Although your organization may recognize co-PDPIs on team-managed projects, we recognize only a single PDPI who will be responsible for the programmatic aspects of the project. If your organization is pending the hire of the PDPI for this project, then name an interim PDPI on your application. And for multiple or group applications, applicants are permitted to submit more than one application only if each is a distinctly different project. If you submit multiple applications for the same project, we will accept only the last application submitted on grants.gov with a timestamp that is before the due date and time. We will disqualify all other versions of the application. Then, if you are submitting as a group or consortium, we will only make an award to a single eligible entity. More than one entity may choose to work together on a project under this opportunity, but only one entity may submit the application. If awarded, that entity will be the award recipient and will be responsible for conducting the project. The other entities may participate in the project if awarded and would be responsible to the recipient for their respective roles, typically as subrecipients. Groups may form a consortium, partnership, or other legally recognized entity for the purpose of applying for this opportunity and carrying out any awarded project. The resulting entity must exist and be legally recognized when it applies and must have an active registration in SAM.gov. We will conduct a risk assessment on the applying entity prior to making any award. Cost sharing or matching is not required for projects under this NOFO. However, applicants are strongly encouraged to demonstrate institutional commitment through investments that support sustainability beyond the federal project period. Additionally, funds from federal grant programs typically are not eligible as cost share for other federal grants, which means it is your responsibility to confirm with other federal agencies whether funds you receive from them are eligible resources to apply to your proposed project. If you include voluntary cost sharing or matching, you must include a detailed listing of any funding source identified in Box 18 of the SF 424 you submit with your application. Then, if you are awarded, the voluntary cost sharing you included may become part of the approved project budget, and the recipient will be held accountable for it. If you lack the required supporting documentation for voluntary cost sharing or matching, the application will be disqualified. So ensure you do not include voluntary cost sharing unless your organization can successfully track the cost sharing or matching and meet the commitment you are outlining in your application. Here you can see the required forms you must include in your applications. If any of these are missing, your application will be disqualified. There are 4 required standard forms you must complete. These include the SF 424 Application for Federal Assistance, the SF 424A Budget Information for Non-Construction Programs, the SF LLL Disclosure of Lobbying Activities, and the Project Abstract Summary. In addition to these forms, you are required to prepare the 3 files highlighted here: a complete project narrative, appendices to the project narrative, and a budget package. And I will provide further detail as to what each of these files should include later on in this presentation. Starting with the project narrative. Here you can see the suggested layout of the project narrative. that covers all the key details needed to achieve the goals outlined in the NOFO. This file has a page limit of 25 pages and should include a complete overview of the proposed approach for your project. So, as you put together your project narrative, make sure you include 1. A statement of need that clearly describes the necessity of improved access to medical forensic examination services within the geographic area to be served, as well as a demonstration of the applicant's understanding of factors that affect women and girl survivors of sexual assault as they access timely, evidence-based forensic healthcare services. 2. An outline of organizational capacity and readiness to successfully implement the proposed project. 3. A comprehensive description of the proposed project model and how proposed activities will improve access to medical forensic examinations and strengthen healthcare system responsiveness. 4. A description of methods for collecting, managing, analyzing, and reporting data related to medical forensic examinations and healthcare delivery systems. 5. A description of partnerships, referral relationships, and coordination activities with relevant stakeholders. 6. A description of methods for evaluating project effectiveness and measuring system-level outcomes. 7. A description of sustainability plans to maintain successful project activities beyond the project period. And 8. A detailed budget aligned with proposed project activities and allowable uses under funds for this NOFO. Further details for what each of these sections should include are included in the NOFO under the Project Narrative Content section. In addition to the project narrative, you are required to submit a collection of appendices to the project narrative. As you put this file together, please note that all items in this section will count toward the total page limit of the application, which is 50 pages for this file plus the project narrative. All items in the appendices to the project narrative must be submitted as a single electronic file uploaded to the attachment section of your grants.gov application. The items included in this file should include the following: a detailed work plan, an organizational chart outlining key positions supporting this project, CVs, resumes, or biographical sketches of key personnel for this project, memoranda of agreement or letters of commitment for partners, subrecipients, organizations, and agencies you are including in your proposed approach, data collection tools and evaluation materials you will be using, technology and infrastructure materials used to support the project, relevant policies and procedures, and proof of eligibility for this initiative and current organizational status. Then comes the budget package, which should include the following. First, an SF-424A, or Budget Information Non-Construction Programs. Second, a budget narrative with detailed justification by cost category and object class. And third, a plan for oversight of federal funds. You should include supporting documentation for your budget as part of the budget package, not as part of your appendices to the project narrative. There is no page limit for the budget package contents. If you are recommended for an award, you may be asked to provide additional information about your budget package. Throughout the budget package, federal resources refers only to the funds you are requesting from the program office for this project. Non-federal resources refers to any funds outside of this NOFO. Funds from federal grant programs typically are not eligible as cost share for other federal grants. It is your responsibility to confirm with other agencies whether funds you receive from them are eligible resources to apply to your proposed project. Please refer to the NOFO for all other budget details and funding restrictions related to this initiative. You must also include a plan for oversight of federal award funds that describes how your organization will provide oversight of federal funds and how award activities and partners will adhere to applicable federal award and programmatic regulations. Include identification of risks specific to your project as proposed and how your oversight plan addresses these risks. The organizational systems that demonstrate effective control over and accountability for federal funds and program income, compare outlays with budget amounts, and provide accounting records supported by source documentation. The specific internal controls for incentives that will be used to ensure only qualified participants will receive them, and how they will be tracked if you propose the use of incentives for your approach. and organizational controls that will ensure timely and accurate submission of federal financial reports to the OASH Grants and Acquisitions Management Division via the payment management system, as well as timely and appropriate withdrawal of cash from the payment management system. If your internal controls are available online, you may provide a link as part of your plan in the budget narrative. Although merit reviewers are not permitted to access any external materials linked in the application as part of their review, this link would facilitate review of your proposal if recommended for risk assessment. Now that we've covered what should be in your applications, we can move on to what you must do to successfully submit your applications and what the review process looks like. Your applications must follow the formatting and page limits seen on this page. Otherwise, they will be disqualified for consideration. These requirements include that all files must be formatted using the English language and US dollars only, have 8.5 by 11 inch page size with a 1 inch margin on all sides. The font within the documents must be no less than 12 points and use a readable typeface such as Times New Roman or Arial. The project narrative file must be double-spaced throughout, and all files must be in one of the acceptable file formats, including Adobe PDF, Microsoft Word, or image formats such as JPG, .gf, or .tif, or .bmp only. It is recommended that you convert all prepared files to PDF before uploading them to ensure you do not inadvertently run afoul of the file requirements. Please note that Microsoft Excel files, spreadsheet files, compressed files like .zip or .rar files, and password-protected files are not acceptable for submissions. In addition to file requirements, your applications must fit within the page limits of 25 pages for the project narrative and 50 pages for the project narrative plus the appendices to the project narrative. The budget package and required forms do not count towards these page limits. When organizing your files, please do not number pages or include a table of contents, as our system will automatically generate these once applications are complete. Please do not include external documents or links in your applications, as reviewers will not be permitted to utilize these links, and only the content included in the file submitted will be considered in the review process. And finally, it is highly recommended that you print or PDF check the full application before you submit to double check that you are within the bounds of all requirements. In addition to the file requirements I just outlined, all applicants are required to have active SAM.gov and Grants.gov registrations to apply. In fact, Grants.gov will not even accept an application unless your organization already has an active SAM.gov and a Unique Entity Identifier, or UEI. If you do not already have these registrations in place, it is highly recommended you begin registration immediately, as the SAM registration can take 2 to 3 weeks or longer, and synchronizing those accounts with Grants.gov can take another 24 to 72 hours. Please do ensure your registrations include and maintain accurate legal names, physical addresses, zip codes, and e-business points of contact information. It is also recommended that you consider registering a backup authorized organization representative in Grants.gov in case any last-minute changes occur. Once you have all required registrations settled, you are then set to submit your application on Grants.gov. Grants.gov is the system that we require all applications to be submitted to electronically. This requirement is only overruled if you have been granted an exemption in writing from the Grants Management Officer for this funding opportunity. To submit your application in Grants.gov, first search for the NOFO by number WH-AST-26-004 or by the assistance number 93.088. This will bring you to where you can submit your applications. It is recommended that you submit an application a minimum of 4 to 5 days prior to the application deadline, as Grants.gov can take up to 48 hours to notify you of a successful or rejected submission. If you are experiencing any technical issues within Grants.gov, please contact Grants.gov and retain the ticket number given to you by the Grants.gov team. If you are submitting an exemption request, they must be emailed to oash_grants@hhs.gov at least 4 business days prior to the application deadline. Approval for this exemption is required before an alternative method can be used. As you finalize your application and move to submit it through grants.gov, please be careful not to fall into any of the common situations that wind up disqualifying prospective applicants. Some of the most common triggers for disqualification include not submitting your application in grants.gov without receiving a written exemption from the grants management officer, not submitting your application by the due date and time, not falling within eligibility criteria for the applicant, duplicate submissions being received for the same project, except the last on-time submission, your application is missing one of the required forms, or the forms are not fully completed at the time of submission, your application requests are exceeding the $1 million award ceiling for this program, and finally, not falling within the formatting or page limit requirements for this funding opportunity. Always check and double check your applications, and if you ever have any doubt for whether you're following the requirements, check back to the NOFO for guidance, as it is the guiding document for applications. After you've submitted your application, it is out of your hands and officially in the review cycle, where the determination for who is awarded is made. This process includes 5 major steps. First, the check that your organization is eligible and qualifies for this funding opportunity, whether you were responsive in your application to the requirements outlined in the NOFO, and whether your application fell within formatting and page limit requirements. After that, it moves on to the merit review, where an independent panel comments and rates each application against the criteria outlined in the NOFO. Then, the results of the merit review are sent on to the federal team that reviews your application for programmatic, budget, and grants compliance. If the application fits with these requirements, it is then sent on for a final risk review that ensures your organization does not have any risks associated with granting federal funds to it. Then, at the end of it all, if your application makes it through, a notice of award is issued to the awarded organization from the grants management officer in coordination with the senior appointee or appointee's designee, and it is not until this step is completed that an award decision is finalized. As stated before, an independent merit review panel will evaluate applications that are qualified and eligible. These reviewers are experts in their fields and are drawn from academic institutions, nonprofit organizations, state and local government, and federal government agencies. Using the merit review criteria, the reviewers will provide comments and rate the applications. We will provide reviewer comments to applicants after we have made final award decisions and issued notices of awards. We do not provide scores. The criteria your applications will be measured against include Criteria 1, Statement of Need and Problem Identification, which will count for 20 points of the criteria score, which includes a demonstration of a clear understanding of gaps in access to medical forensic examinations for women and girl survivors of sexual assault, an identification of workforce shortages, healthcare delivery barriers, geographic disparities, systems fragmentation, or reporting limitations affecting access to forensic healthcare services, the use of relevant data, evidence, or community-level information to support the identified need, the description of the geographic area to be served, and the demonstration of awareness of challenges impacting rural, tribal, territorial, underserved, or resource-limited communities where applicable. Then the second criterion is organizational capacity and partnerships, which also is 20 points for your total score. This includes the demonstration of organizational experience and capability relevant to forensic healthcare services, healthcare systems improvement, public health, data modernization, or multidisciplinary coordination, the demonstration of appropriate staffing, operational infrastructure, and project management capacity, the inclusion of qualified personnel and subject matter expertise necessary to implement the proposed activities, the demonstration of strong partnerships and collaborative relationships with healthcare systems, tribal entities, forensic nursing programs, victim service organizations, public health agencies, academic institutions, telehealth providers, or other relevant stakeholders, and the demonstration of the ability to successfully manage federal funding and project implementation activities. The third criterion is program design and project approach, which is 30 points towards your total score. And this is demonstrated through the presentation of a clear, practical, and feasible project design aligned with the goals of this NOFO, the demonstration of an evidence-based approach, the inclusion of effective strategies to improve access to medical forensic examinations and strengthen healthcare system responsiveness, the description of realistic and measurable implementation activities, timelines, and deliverables, the inclusion of appropriate plans related to workforce development, telehealth expansion, data collection, healthcare coordination, systems improvement, or quality improvement activities where applicable, the demonstration of understanding of healthcare delivery systems and multidisciplinary coordination, and a clear explanation of how proposed activities will improve women and girl survivor access and healthcare coordination, reporting capacity, or systems level outcomes. Then the fourth criterion is data collection, evaluation, and performance measurement, which counts for 15 points towards your total score. This includes a clear and feasible plan for collecting, managing, and analyzing and reporting project data, the identification of measurable outcomes and performance indicators aligned with NOFO goals, the demonstration of the ability to evaluate project effectiveness and systems level impact, the inclusion of strategies for continuous quality improvement and performance monitoring, the addressing of data privacy, confidentiality, and secure information management practices, and the demonstration of the ability to support statewide, tribal, territorial, regional, or organizational reporting activities related to forensic healthcare access and systems improvement. Now, the fifth criterion is sustainability and long-term impact, which counts for 5 points towards your total score. This includes the demonstration of potential for long-term sustainability of the proposed activities, the inclusion of plans to maintain partnerships, workforce capacity, operational systems, or reporting infrastructure beyond the project period, the demonstration of potential for scalable or replicable systems level improvements, and the description of how project outcomes may contribute to long-term improvements in healthcare access, coordination, quality, or women and girl survivor support systems. And the last criterion, the sixth criterion, is budget and budget justification, which includes 10 points towards your total score. And this includes a reasonable, well-justified, and cost-effective budget aligned with proposed activities, the demonstration of appropriate allocation of resources to support project implementation and outcomes, a clear explanation of proposed costs and budget assumptions, and a demonstration that requested funding is necessary and appropriate to achieve project goals and objectives. And with that, we are at the end of our overview of the Medical Forensic Access Initiative. If you have any questions following today's webinar, please do not hesitate to the appropriate contact you can see here. For any questions about administrative or budgetary requirements, please contact Eric West from the Grants and Acquisitions Management team. For any questions about program requirements, please reach out to Gage Dalton, the Federal Project Officer from the Office on Women's Health. For grants.gov support, please reach out to the grants.gov team. And for any SAM.gov registration support, you can contact the SAM.gov service desk. And that is everything we have for you today. Before closing, I wanted to highlight a few key reminders. First, please remember the NOFO is the cornerstone document that governs everything under this funding opportunity. Your first step to answering any questions should always be turning to the NOFO for guidance. Second, please subscribe to this funding opportunity on grants.gov under grant number WH-AST-26-004 to stay apprised of any updates related to this funding opportunity. Third, ensure you submit well before the application deadline to avoid any technical issues that could impact your ability to submit for this initiative. And lastly, today's meetings with slides, recording, and a list of frequently asked questions will be posted according to the final webinar plan. Thank you all for taking the time to listen to today's Technical Assistance webinar for the Medical Forensic Access Initiative. We at OWH are thrilled to see what approaches are included in the applications for this initiative, and cannot wait to see what steps we can take to advance access to medical forensic examinations for women and girl survivors of sexual assault across the United States through this initiative. We hope you have a great rest of your day.